Welcome, everyone, to QRIS and Family Engagement, a Strengthening Families approach. The BUILD Initiative and the QRIS National Learning Network are hosting this webinar to provide information on innovation, emerging, and best practice across the country as states work on early childhood systems building and improving services to children and families. I'm Debi Mathias, Director of the QRIS National Learning Network. We're so pleased to be sharing this information and the resources from the Strengthening Families National Initiative. This webinar is made possible through the generosity of funders to the BUILD Initiative, including the Birth to 5 Policy Alliance. A few mechanics. Please use the chat box feature to ask questions. We'll try to get to questions either within the chat box in a reply, or we'll bring them up and ask the speaker as time permits and breaks in conversation are provided. So thank you all for being here, and we'll get going. Okay. Many states have been grappling with which standards to include in their QRIS. The national considerations have grown to include the few and the powerful standards. Are they understandable and significant? Are they evidence-based? Are they measurable and feasible to monitor? Are they progressive? And are they valid in demonstrating a distinction among quality levels? Many states have ended up focusing on areas such as workforce qualifications and professional development, teaching and learning, including observational assessments such as the class and the environment rating scale, child assessment, and others. Some states are considering and putting staff-child ratios into their standards, especially if they're not sufficient in the licensing standards within the state. Many states are using a continuous quality improvement process standard. In early childhood, we know how critical and important family engagement is, and states are looking to that standard and thinking about how and should they include a family engagement standard in the QRIS part of the work. They're trying to figure out how to have a family engagement or family support standard that's understandable and significant, evidence-based, measurable, and feasible to monitor, that demonstrates this progression and that helps to show that valid distinction among the levels of quality within a program. States are moving beyond criteria, such as having a parent handbook, a family bulletin board, 2 times a year parent information meetings. Although these items lend themselves to ease of monitoring and are clear and straightforward for everyone to understand, they don't get us where we want to go in partnering and engaging with families to support their children's growth and development. States are working to support deep, meaningful engagement and deepen considerations of this important element of early learning partnership as a part of their quality continuums. But how do we award points or tier this type of standards? Are there forerunner or beginner things you can get started with? What does the ultimate family engagement and support look like? What are the steps moving up a quality continuum? These are questions states are beginning to ask themselves. How can state move beyond just the rating aspect of a family engagement standard and include tools and supports for programs in the I, or improvement part of the QRIS work? How can we not only have something we might use in the rating portion of the continuum, but then what are the supports necessary to really help programs improve and progress and move ahead in this area? For some assistance in exploring these important questions, I'd like to turn the program over to Anna Lovejoy. She's a consultant and member of the Strengthening Families National Team at the Center for the Study of Social Policy. She's the team's lead on early childhood issues and state and federal policy. Prior to consulting, Anna was the program director for early childhood policy at the National Governors Association Center for Best Practices. Anna, welcome, and thank you for helping us explore this topic today.
Thank you, Deb. Thank you so much. I hope you can hear me. So thank you all, and thank you especially to the BUILD Initiative and the QRIS National Learning Network for inviting us here today to share with you some of the activities and approaches that states in our national network are taking to integrate the Strengthening Families approach into their quality rating and improvement systems. I'd also like to thank Megan Robinson at BUILD for your awesome technical support to get us here today. So thank you so much for helping us get organized. And thank you to the participants for answering the few brief questions that we asked when you registered, just to get a sense for where you are and where your state is in thinking about family engagement standards and strengthening families within the context of a QRIS. Your information helps us just to have a sense of a good national view of what's going on across states, so we really appreciate that information. So I'm going to take a few minutes to share with you a little bit about the Strengthening Families Initiative for those of you who might not be quite as familiar, so you have some common ground to start with. Then I'm going to talk a little bit about what we're hearing from states that have already used the Strengthening Families approach to inform their quality rating and improvement systems. What they find as some of the key advantages from the Strengthening Families approach. I want to share with you some of the implementation tools that are available from CSSP and some of our national partners that might help states and programs to integrate Strengthening Families into their QRIS. Then I'd like to spend some time actually sharing some of the state approaches that we have found going on across states in taking lots of different strategies and different ways for bringing Strengthening Families into their QRIS. I'll offer a few tips for getting started if any of you are interested in pursuing this further, and talk a little bit about some of our future directions for this work within the Strengthening Families Initiative. After that, I will proudly introduce my colleagues from Washington State who are going to share their own example of how they went about making decisions about their quality rating and improvement system, why they chose to incorporate Strengthening Families into their QRIS, and how they took the important step of involving parents in informing not just their quality rating and improvement system, but their overall state plan for early care and education as well. So I will be introducing our state speakers, Shard Goodrow from the Department of Early Learning in Washington State, and Robin Higa. But I will introduce them more formally when we get to that part of the presentation. So now I'm just going to flip to the next slide if I'm doing these controls correctly. Yes, okay. So what you see on your screen is the logic model that sort of underlies the Strengthening Families approach and the national initiative. If you'll bear with me. Talking points. So the Strengthening Families began back in 2001 as really an effort to figure out ways to strengthen and improve child abuse and neglect prevention efforts, and bringing that to the level of early care and education programs as strong partners and obvious partners in abuse and neglect prevention. The work began with support from the Doris Duke Charitable Foundation back in 2001, and the CSSP began studying, with their support, studying the role that early care and education programs could play in strengthening families and preventing abuse and neglect. So for the first time, research about preventing abuse and neglect was linked with similar knowledge about quality early care and education, and CSFP developed a new conceptual framework and approach to preventing child abuse and neglect, which they called strengthening families. And this approach involves building evidence-based protective factors around young children by working differently with their families. CSFP spent a year in the field learning in a structured way from exemplary programs and practitioners around the country about how to build protective factors on the ground in early care and education settings. This knowledge base was used to develop tools to support early childhood programs, policymakers, and advocates in making small but significant changes that build the protective factors. So if you look at the logic model, you'll see that we have a column labeled protective factors. And so these are the 5 factors that I just referenced. And they are parental resilience, social connections, knowledge of parenting and child development, concrete support in times of need, and the social and emotional competence of children. So those are the factors that, when they're present in families, the results are strong families, optimal child development, and reductions in the likelihood of abuse and neglect occurring. So through the field research, CSFP identified this list of strategies, which is the second column in the logic model, that inform very small but significant and concrete things that programs can do to support families in building these protective factors. And I won't read them all out, but you'll see these strategies are categories of things that fall under things like facilitating friendships and mutual support among families and between families and staff, efforts to strengthen parenting, responding to family crises as they occur, things of that nature. So through the field research, Strengthening Families identified slew of things that programs can do, and many of them low or no cost. And we use that to inform development of a self-assessment tool for programs, which I'm going to talk about in a little bit, but has been really foundational, I think, to helping to really operationalize strengthening families on the ground in programs in very meaningful ways. So real quickly, after this sort of conceptual phase and the field research, Strengthening Families moved into a pilot phase with 7 states, engaging in a learning partnership to figure out ways to implement this approach in programs, and then through that work, identifying the policy levers, the professional development approaches, and ways to strengthen and use parent partnerships to get this message out and really create a whole new culture around protective factors and building partnerships with families and building these protective factors. So now we have a national network of Strengthening Families participants. It links over 30 states across the country that have active Strengthening Families cross-disciplinary leadership teams at the state level that are working to implement this Strengthening Families approach, not just into early care and education programs, but also finding that it's very applicable and useful to home visiting programs and child welfare practice, and of course child abuse and neglect prevention, and all of those other sectors that really involve and serve and support children and families. We also have a network of national partners that are part of the initiative, like the United Way Worldwide, the Friends National Resource Center for Community-Based Child Abuse and Neglect Prevention. And one of our great longtime partners is the National Alliance of Children's Trust and Prevention Funds, and I'll share a little bit about their work in a minute. But anyway, we have a lot of these national organizations like BUILD and others who are joining with us to help implement Strengthening Families and the concepts and the principles behind it in a variety of sectors and bringing this message to their constituents. So we're grateful to them because we can't do this work alone, and we've just been so thrilled that organizations and individuals seem to come to us because they see the value of the approach to the work that they do. So we're just thrilled that we're able to have as big a tent as people want to make it.
Anna, we've had a question about which 7 states were involved.
Oh, okay.
If you know off the top of your head.
I should at this point, but that was a little bit before my time with the initiative. But there is information on our website at www.strengtheningfamilies.net. And then there's a tab that you can click on called Around the Nation, and then within that you can find your way to the states page. And I think there's information about that. I can also follow up with everybody or anyone individually to identify those states for you.
Oh, that's just great. Thank you.
Sure thing. Okay. All right. So let's talk about quality rating and improvement systems, and what does Strengthening Families have to do with that? At this point, we know or we've heard from about 20 or so states that some of which have actually integrated Strengthening Families in some way into their systems. Some are looking into it, considering it. Some are at least thinking about it and curious. And we know from the number of participants on today's call that this is a good topic of interest among many of you. So we're really happy to be able to have this information to share with you. But we're finding that states are interested in looking at this for a couple of reasons. One, I think because the Strengthening Families offers an intuitive framework for what families need and what programs can do to support them. In some ways, if you look back at the logic model and the protective factors, they're sort of no-brainers, but I think what's helpful is that the framework really lays it out very clearly for anyone, what families need, and then from there we can think about what programs can do to support families. Strengthening Families also offers a broad range of concrete, low, and no-cost actions that programs of all types can implement. I touched on that a little bit before, and if you wanted to take a look at the self-assessment tool, which you can access through our website, you'll see it specifies a very wide range of different concrete things that programs can do. Some of them are very simple. Many of them are things that programs are already doing, but maybe don't recognize them as Strengthening Families, but they're easy things. And others are things that with a small bit of support or a few resources or some creative restructuring of programs can achieve them easily. And then finally, I think related to that also, there are a third reason is that there are free and easily accessible tools and resources available from CSSC and others of our national partners to support implementation at the program, the policy, and the systems levels. Given all of those, I think the next thing I wanted to share was what we're hearing from states as some of the advantages of using Strengthening Families in a quality rating and improvement system. I think Deb touched on the fact that many states are recognizing the need to go beyond the traditional 1 to 2 parent conferences a year and a monthly newsletter to really think about how do programs really meaningfully engage and support parents in supporting their children's development, because parents really are they're children's first teachers, and you're not going to get to good results for children without really supporting and engaging parents in this very powerful role. So I think some of the advantages that Strengthening Families has to offer, the design and implementation of quality standards within a QRIS specifically related to parent or family or community engagement, are a couple of things. One is that Strengthening Families informs a comprehensive and concrete definition of family engagement. The protective factors and the program strategies that the approach lays out, again back to the logic model I shared with you, again are very clear, intuitive ways that we can engage families. The 5 protective factors are demonstrated by research to be linked to optimal child development as well as reduced rates of child abuse and neglect. And as I mentioned, there are concrete tools available already to help support implementation on the ground in practices, in program practice. Another reason is that Strengthening Families offers a flexible roadmap for programs to achieve family engagement outcomes. One of the things that we've heard from states is that the approach offers a high degree of flexibility for states in deciding how the framework and the program strategies inform state quality standards and are reflected and measured across the tiers of a rating system. I want to emphasize there's no right way to do it. At this point, we welcome all ideas and approaches that states are considering because I think so much of what parents need varies, but family to family and community to community. And I think the value of Strengthening Families is that it offers a range of what programs can do to support them based on families' needs and the resources available to the program and within that community. And it gives states the flexibility to think about how to apply the principles and the strategies across the tiers in a way that makes sense for providers in their community. We heard from one state that wanted to eventually get to use, say, the Strengthening Family Self-Assessment tool as one of the measures or one of the tools that programs could use to document and verify that they are meeting their quality standards around family engagement, but that a lot of their providers just weren't there yet and had never even seen a self-assessment tool, and so that was a little bit beyond what they could comfortably manage at least at the lower tiers. So we talked through some thoughts about how you would maybe lift a few of the low-cost items out of the self-assessment, put them into the lower level tiers, and then slowly sort of work up to building their capacity to use a self-assessment later on. So there's again a lot of flexibility, and I'll share some more of those approaches in a minute. But a few more points I wanted to make before I get to that. Another advantage is that Strengthening Families indeed does align with nationally recognized indicators of quality and family engagement. For example, we are right now in the process of doing a crosswalk and to demonstrate the alignment between Strengthening Families and the National Association for the Education of Young Children's accreditation standards related to family engagement. And we hope to have something available to the field on that fairly soon. We also have a working group with some of our state Strengthening Families leadership teams, some Head Start program grantees, Head Start collaboration directors, and some others from a number of states working together in collaboration with our partners at the Office of Head Start at the federal level and the National Center on Parent, Family, and Community Engagement to look at how Strengthening Families aligns with the new Parent, Family, and Community Engagement framework that Head Start has developed. And so we are in the midst of conversations about that and hope to have something useful and helpful for the field within the next couple of months so that programs, whether they're doing Strengthening Families or they're taking on the Head Start framework or trying to do both, that programs see the value of both and take kind of the best from both and not leave anything behind, but also not have to duplicate efforts if you're using different self-assessment tools, et cetera. So we're hoping to be able to have something useful coming out on that soon. And our future, some of our future work we will also be looking at how Strengthening Families aligns with other national quality standards and tools such as the environmental rating scales or the class or other things. We'd really like to unpack those and see how closely they align with what's in the Strengthening Families approach too, just to be helpful to states. And finally, Strengthening Families provides a platform for linking QRIS to broader systems building efforts in states. We know, that's certainly a hot topic among many states, struggling to bring about, pull together pieces of not just the early care and education system, but health, home visiting, mental health, family support, and others. And so to the extent that Strengthening Families offers a a framework for how you talk about what families need, then integrating strengthening families into a QRIS can help the QRIS really fit into the broader context of that conversation in your state.
Hi, Anna. It's Deb. You know, I really like what you're saying there about the connectivity and the linkages between early intervention, home visiting, the health work, all of the areas of the early childhood systems building. It really gives us a common language across all the sectors, again, to knit us all more closely as a system. I think that's a very important point you're making there.
Thanks, and we hear that from states all the time, and it's really, I think, been a hallmark of the Strengthening Families approach is that it's always been multidisciplinary, and the framework is just very useful in providing sort of common language and common outcomes for all of these different parts of the broader early childhood development system. So we're happy to be involved in conversations at the national level about how that works and what we're learning from states as well. Real quickly, I wanted to touch again on some of the implementation tools that states are using, and then I'm going to talk about some of the actual ways that states are using them and what Strengthening Families in QRIS looks like in a couple of other states. How am I doing on time, by the way? Debbie, can you?
Yes, getting off mute.
Oh, sorry.
No, yes, you should start to keep going, yes. Like okay. You have about 15 more minutes.
Okay, perfect. Okay, great. So a couple of the tools. One, I've already mentioned the Strengthening Families Program self-assessment. So again, this is taking from the field research that CSSP did, looking at exemplary programs, identifying the range of strategies that these programs engage in every day to support families, and organizing them around these 7 program strategies. So that, and building a tool so that programs can sort of ascertain where they are, what they're already doing, and give them ideas for what other things they might want to be doing, or set goals for how they could move forward if they chose, based on what their families and needs were and their available resources and in the community. I just wanted to highlight that the paper version of the self-assessment is currently on this CSSP's Strengthening Families website to download in paper form. It's available there's one version for center-based programs and another that was designed more for family child care programs. The one for center-based is also available in Spanish. We haven't had the capacity yet to do the Spanish version for family child care programs. But we're always looking for volunteers out in states that might be willing to take a crack at translating things for us. So let me know if that's something you'd be interested in helping us with at some point. The next item, and I realize I'm behind on my slides. Let me flip forward for you. So the next item on my list is the Strengthening Families online data system. So CSSP partnered with Mosaic Network, Inc. to develop this data system, which basically houses an online version of the self-assessment tool that also includes a tool to help programs turn their results into simple action plans for moving forward. It also includes an online version of the Protective Factor Survey, which is a tool developed by the Friends National Resource Center to reliably and validly measure changes in parental protective factors. It also includes an online staff survey tool and pre-designed reports to help programs understand where they are and where they want to go, but also is available in the aggregate for state-level administrators to look across programs to identify trends and inform decisions about training, technical assistance, and other forms of program support. And I think I saw a question out there about how our states using the aggregated data, and like I just said, I think several of them are really using it to identify where they can fill in gaps on training and technical assistance, and how they can build more capacity, say through their quality improvement specialist networks, et cetera. So those are some of the ways that they're using that data. And there's more information about the online self-assessment tool available on our website if you want to go check it out. The third resource that I wanted to mention, and we are so thrilled and pleased that it's available, is actually something developed from our partners, the National Alliance of Children's Trust and Prevention. Developed a set of online, freely available factors courses that offers an overview of the framework and provides modules on each of the protective factors. It also includes quizzes and activities and reflective questions, an online forum that allows the learners to interact with each other and go deeper about what they're learning. It's available. Because it's online, it can kind of branch off depending on your role, if you're a early care and education provider or a child welfare worker or a child abuse neglect prevention practitioner or a parent or an administrator or anything in between. It has flexibility to sort of tailor the content more towards your interest and your role. And users can print a portfolio that includes their responses and an individualized action plan for learning more. And it's directly linked to the online data system that we have. Some states are getting some technical assistance from the Alliance on how to link it into their professional development systems and their QRIS training requirements, and figuring out how to maybe make the training eligible for CEU credits, things like that. So you can always go to the Alliance for more information. The link is there in the slides. But we're just thrilled that it's out there and available and free to anyone who's interested in using it. I think at this point there are over 2,500 individuals who have participated in it already, and it's only been available since last spring. So it's a very, very exciting tool to have, I think, for the field. So now I want to turn our attention to what states are really doing around putting strengthening families into QRIS, and how are they using these tools and taking other approaches to informing their standards and supporting programs. I do want to mention, and there's a link at the end of the presentation slides to the full issue brief that we've written on this topic. There's an executive summary also with the main points, but there's also a matrix of state examples with links to individual state websites, but also has some details, state-specific details that you can access directly to learn more about what individual states are doing. But a couple of the approaches that we're seeing from what we're learning from the states. One is that some states have taken sort of what I call beginning entry points, or almost like a light touch, but basically including strengthening families criteria, or including the self-assessment as an optional tool that programs can use to document that they are meeting standards that align to family engagement, or including strengthening families trainings as optional or required professional development criteria within their QRIS. So these are states like Missouri, at least in their initial pilot, New York, New Hampshire, Arkansas are all taking. And each of those states has approached it a little bit differently. In some cases it's optional. In some cases it's an optional to score points towards another level. In some cases it's required to actually go to the next level. And again, we're just interested in seeing how these different approaches play out among the programs that are implementing them. Another point I wanted to make is several of the states that we talked to have kind of let strengthening families integration sort of bubble up from programs on the ground as their QRIS systems evolved. And they went back to providers and community members to kind of get feedback on initial pilots or standards as they were reviewing them. States like Massachusetts and Washington State have heard from folks in the community that were already implementing strengthening families about the value of the approach to informing family engagement standards. The issue brief talks a little bit more about that, but those are another point for states that maybe have already developed and implemented a QRIS, but since they are typically sort of continually changing and continuous improvement of the quality improvement systems themselves, we feel there are probably lots of opportunities along the way to think about and tweak how strengthening families can help support family engagement outcomes through QRIS. And then finally, some of the 4 states in particular that are highlighted in the brief in a little bit more detail, have really taken strengthening families a little bit more comprehensively into their QRIS. So states like Idaho and Massachusetts, which both have fairly mature QRIS implemented already and really have integrated strengthening families very foundationally to their family engagement and support criteria. In Idaho in particular, the prevention of child abuse and neglect is actually one of the 3 goals of the QRIS, in addition to promoting good outcomes for children. And so strengthening families is itself its own standard, and criteria flows from there, and they have requirements over the use of the program self-assessment and development of program improvement plans and training that's available. They have a very robust training that's available related to strengthening families. So I think they are a great example of what this can look like across all aspects of a QRIS. They and Massachusetts also have quality improvement specialists and support quality improvement support efforts that include support around strengthening families using the self-assessment and training on the protective factors for programs. Georgia and Washington State are 2 other programs that are worth looking at. Georgia has integrated use of the self-assessment tool and has basically left the option for programs based on their self-assessment results to choose from among the different program strategies, either 1 or 2 or 3 strategies that the program is going to choose to improve upon to score more points to qualify for higher levels of quality in the rating system. Theirs is just rolling out, so we're really curious to see what how that plays out. The other thing about Georgia that I wanted to mention is they also used the Strengthening Families approach to inform their standards around supporting culturally and linguistically competent practice in programs. Strengthening Families, the approach and the program strategies were all developed intentionally to support those types of practices. And CSSP even more recently engaged in a process with some national experts to review, validate, and recommend enhanced language throughout the self-assessment to further support such practice. So we actually are going to be revising the self-assessment in the coming year, and so the next iteration of that tool will reflect those recommendations and be even more, I think, explicitly supportive of culturally and linguistically competent practice. I'm not going to go into Washington State because our speakers here are going to tell you all about the journey that they took to get there and what it actually looks like. So I would just like to close out my remarks by offering a few tips for getting started to any states that are interested in learning more and maybe exploring ways that they might integrate strengthening families. And I think the first, particularly for those involved in the QRIS design or redesign effort, if your state has a strengthening families leadership team, a great place to start is just reaching out to folks on that team to find out what they've been doing and what's going on and what is the state of implementation of strengthening families, particularly within early care and education programs. Another easy step is to just review the resources and tools that I've mentioned today and think about how that might relate to other things that you have to offer and other things that you want to build into your QRIS. Certainly reviewing other states' QRIS designs and standards, and we hope that the issue brief that we've just published will help point you in the right direction towards some of those states. And also, feel free to reach out to us at the Center for the Study of Social Policy, but also the QRIS National Learning Network, if I can be so bold as to volunteer our colleagues there. Or we've also been in conversations with our colleagues at the National Child Care Center on Quality Improvement because they're also interested in helping states to build and implement their QRIS, and they recognize family engagement as one of the important aspects of a QRIS. So we've actually already gotten together to do some joint technical assistance calls for states on this topic. So just a reminder that those are three resources out there that we hope you'll think about contacting us, and we'd be happy to help connect you to other states, etc. And last, and I'm getting ahead of Robin Higa's presentation, but just always want to emphasize the importance of engaging parents in addition to and along with engaging providers and community members in the process, but really thinking about effective ways to get parents to the table and hear from them about what's important to them would be useful. And for those of you who are actually on Strengthening Families leadership teams, I would just say if you're interested in helping your state move forward, just going to your QRIS administrator and your design teams, sharing information about strengthening families, bring the issue brief and see if they're interested. Talk to programs on the ground in your state to find out what their experiences are and encourage them to go directly to the design teams as well with their experiences about how strengthening families is useful to program practice. And finally,
Anna, we've had a number of questions about the research basis for the Strengthening Families continuum. Are you showing that the use of this does improve or change practice? I know that on your next slide with future directions, I'm looking ahead on a slide, you're talking about working on validation within the QRIS of the Strengthening Families strand. But could you just talk a little bit about or give us the resource of where people could go to find more information about the research base for the Strengthening Families work?
Right. So on our website, there is a literature review that basically makes the case and presents the research for tying the protective factors to child abuse and neglect and optimal outcomes for children. So that was the foundational piece, I think, that informed the initiative from the beginning. I'd say at this point that is validation is, I think, an important next step because strengthening families in QRIS has kind of only relatively newly been emerging in states. We haven't seen any validation studies yet, but we hope to encourage states to consider that, consider including strengthening families aspects within their validation studies for those that where it's actually in their systems. Because I think we're very curious to know. We don't have those answers right now, but we would like to move in that direction. That's the other thing I'll mention is CSSP is also one of the national partners in supporting the work of the National Quality Improvement Center for Early Childhood, which is a center under the Administration for Children, Youth, and Families, but they are doing some research on strategies that actually do build protective factors. They're developing a new tool that will hopefully help to measure changes in protective factors with families themselves. So, it's a little ways away before anything is going to be available to the field, but we're hopeful that these tools will go a long way in the near future to helping to do that. So, basically it's an emerging area. We're very interested in working with folks to try and answer some of those questions. We just haven't gotten there yet.
All right, just one final question, and then I know you're going to talk about future directions a little bit. On the website, is there a list of the Strengthening Families State Leadership Team contact information? If someone from a state wanted to know who within their state was on the Strengthening Families team?
Well, there's not a list, like a document that you can download that lists everyone, but we do have individual state profiles on the website. So you can click on your states, and there should be contact information for one of the lead contact in your state. If your state if your profile is not live, that means we haven't finished it, or it's still in the works. So if you can't get to that information that way, you can contact me, and I will make sure I get that information to you.
Okay, great. So we're going to move ahead, right?
Yeah. So I think we've already talked a little bit about sort of my concluding thoughts, which is our next directions. Again, we'd like to do a little bit more to demonstrate alignment with some of the other nationally recognized quality assessment tools, sort of pushing the envelope on how to use Strengthening Families to help promote culturally and linguistically appropriate practice, and validating Strengthening Families criteria in the QRIS is something, again, we'd like to see more of from states, and are interested in supporting that effort. I think at this point I would like to turn things over to my colleagues from Washington State. So I'll just introduce both of them, and then they can tag team the handoff. The first speaker is Shar Goodrow. She is the QRIS Administrator at the Department of Early Learning in Washington State. And since coming to the department in 2008, she has assisted with the development and implementation of Washington's QRIS, which is called Early Achievers. And she assisted with the state's successful Race to the Top Early Learning Challenge Grant application. Congratulations, Shar. So we look forward to hearing your presentation in a minute. And she will be followed by Robin Higa, who is a consultant with the National Alliance of Children's Trust and Prevention Funds. She's also a parent volunteer on Washington's Strengthening Families leadership team, and she's the founder and principal author of the Community Cafe Approach, which I'm sure she'll tell you more about in her remarks. But I'm just grateful to these two ladies for being available to share Washington's story today, and I look forward to hearing their remarks.
Great. Well, thank you, Anna. So I will go ahead and get started. So I was asked to share a bit about Washington's decision to embed the Strengthening Families framework into our quality rating and improvement system, which is called Early Achievers. And as I reflected on that request, I realized that it was more of a series of events that led to that decision, events and feedback from both child care providers, partners, and parents during our 2-year pilot, which we refer to as the field test here in Washington. All decisions that were made in regard to reframing the quality standards were based on data collected during the field test that align with the Department of Early Learning's existing initiatives and priorities, as well as the department's primary goal of ensuring all children are school ready. Washington State made the decision to embed the Strengthening Families framework within our QRIS after a 2-year field test, which concluded in 2011. In partnership with Thrive by 5 Washington, the Department of Early Learning piloted our QRIS in 3 counties across the state and the 2 Thrive by 5 Washington demonstration sites in White Center and East Yakima, which are actual neighborhoods. We worked with over 100 facilities during the field test, both child care centers and family child care providers, that volunteered to test the quality standards as well as provide feedback about the system overall. There were several goals of the field test. However, the primary objective was to evaluate the efficacy of our quality standards, the rating structure, and to really take a look at the infrastructure necessary to implement a QRIS statewide. Like most states, we included standards focused on family engagement, family involvement, and family partnerships. The standards were developed based on national research as well as recommendations from stakeholders, partners, and early learning professionals after an environmental scan in each community and county. So every community and county weighed in on what they sort of prioritized as important for the entire set of standards, including the family engagement standards. The original family partnership standards were typical to most states, focusing on a combination of indicators targeting family engagement and involvement that were considered suitable for both family child care and child care centers, as we only have one set of standards. We do not have a separate set of standards for centers and a separate set of standards for family child care providers. And at the time, we employed a block system, where providers had to meet all the standards in one level before moving to the next, with more complex requirements at the higher tiers. Although each standard area presented its own unique challenges, this standard area in particular seemed to require more consideration over time, and I'm going to talk a little bit about that right now. So first, we found to effectively measure family engagement and involvement is difficult. The way our standards were written at the time required us to rely heavily on documentation, such as things that Debbie mentioned earlier, like copies of newsletters, parent handbooks, schedules from conferences, etc. And although these were very important and certainly valuable in the context of a child care facility, they didn't really demonstrate that the facilities were being thoughtful about actually connecting with families, and we had no way to measure the impact of these activities in the context of the broader facility quality improvement efforts that were happening. And it also, we weren't connecting with families, which was a big gap. Most importantly, we were not hearing from the parents, so we couldn't go back and ask them, are these meaningful activities? Do you feel like you're being included in the facility's sort of day-to-day decision making and decisions about the care your child is receiving? Further, by virtue of the block system that we were using, we found that it was easy for facilities to focus on standards at one level and not look at family engagement and involvement in a comprehensive manner. Although the standards were certainly designed to flow from one level to the next, it was difficult for participants to see how they all fit together. And it was particularly difficult to ensure that the standards worked in both family child care and child care centers, which was an obvious issue considering we had to come up with one framework. We heard feedback from our family child care participants in particular that the standards were not reflective of their unique approaches to working with families. In particular, the standards that focused on involving families in decisions that extended beyond those that had a direct impact on the children in care, but the business overall, were met with some resistance. We also discovered that this standard area was not prioritized within facilities or in the field test communities in general. In year one of the field test, we asked each field test site to focus on a standard area that they considered high need and that they had existing capacity to support. Not one of the 5 chose family engagement and partnership. And when we dug a little bit deeper into why, the common response was that providers in general felt that this was something they were already doing well. They had no complaints from families, and by virtue of being selected by parents to care for the children, they felt that they clearly were doing something right. So there was a disconnect between active family engagement and partnership and parent satisfaction. Further, there was not a lot of training or other professional development opportunities that were offered consistently statewide that focused on this topic, and what was available typically focused on topics like marketing and outreach. These initial findings started discussions between the partner agencies about the need to consider other options once we moved out of the field test. The second piece of this emerging puzzle came in early 2011. In the midst of the 2-year field test, we were afforded the opportunity to work with the National Alliance of Children's Trust and Prevention Funds to bring together a diverse group of parent leaders to inform the system moving forward. For 2 days, representatives from the community cafes, the Department of Early Learning Parent Advisory Group, and parents representing Early Support for Infants and Toddlers, which is our state early intervention program, discuss these simple questions. What does quality mean to you? What does it look like? And how will you know when it's happening? In order to define their charge, they came up with a phrase to guide their discussion, and that phrase was, I will know it when I see it. And I wanted to share a little bit of Charlie Bruner's summary of the events because I really feel it captures the tone and the participant perspective. Parent leaders underscored that fundamental to quality and care is the relationship the provider has with the child and his or her family. All care arrangements must be safe and healthy, and the single best marker for determining if they contribute to the child's development is whether the child is welcome, attended to, participates, and has fun within the setting of learning and activity. And fun came up a lot. That was mentioned throughout the course of the 2 days that was a really big priority with parents. The heart of the program is its staff and the staff's willingness to see the uniqueness of each child, the child's value, and the common aspirations for all children to succeed. This comes before teacher credentials, curriculum, activities, field trips, and play environments in defining quality. Parent leaders further stressed the need for programs to develop open, two-way communication with parents and family members, learning from families, from their traditions, from their cultures, and the values and knowledge of their children, as well as providing information to them. As another fundamental tenet of quality, parent leaders saw the critical importance of embracing diversity without stereotyping individual children, but still acknowledging their family and communities of culture and traditions. These were common aspirations for all children to achieve their full potential according to their strengths and their interests. For most children, this means skill development that enables them to be successful in public education systems that set proficiency standards for reading, mathematics, and other basic knowledge. One of the parent leaders made a statement towards the end of the 2 days together that seemed to reflect the overwhelming sentiment being expressed by the entire group. And her statement essentially was that 95% of the wealthiest parents in the world, and she used Bill Gates as an example, have inherent resources to nurture their children, and those resources are the same as what every other parent has. So stated simply, there's no substitute for supporting and strengthening parents in their child's development and child care programs, regardless of setting or sector. And parents are most helpful when they start, or providers are most helpful when they start where families are and give them additional information, support, and connections. So this group identified 4 priorities moving forward. And the first is working with families and communities, inclusion and diversity, resources and communications, and fun, healthy, and safe environments. Parents then identified activities and actions that providers could demonstrate so they would know it when they see it. And included on the list were things like sharing teaching styles with parents, involving community members and tribal elders within the facility, providing resources to parents to learn about the protective factors in child development in general, and enjoying similarities and learning from differences. And now I would like to briefly discuss how all of this impacted the redesign of our system. So throughout the field test, we knew that the standards would change, and we messaged that very clearly to our participants as well. Each field test community had advisory groups focused specifically on making recommendations to the Department of Early Learning and Thrive by 5 Washington. And those recommendations, as well as the evaluation data from our partners at the University of Washington and the parent feedback that we received from the 2-day event, were considered when developing the new framework. The University of Washington was charged with developing the standards based on all the pieces of data that we pulled together for them, as well as the recommendations from the cross-agency leadership team from DEL and Thrive by 5 Washington. And a key recommendation that came out of all that work was to include strengthening families in some way within the system. In terms of family engagement, we wanted to ensure that our consideration for families around QRIS extended beyond the R, and we wanted to create a flexible framework that prioritized parent voice and parent need. So our current framework, Early Achievers, which we began implementing in July of 2012, is a hybrid approach, where levels 1 and 2 are required elements, and levels 3 through 5 can be met by meeting a minimum threshold on the environment rating scale and the class, and through points earned on state-specific standards. Level 1 of our system is licensing, military, or tribal certification, our Head Start, our state pre-K participation, which is called ECAP in Washington. Washington has some of the strongest licensing standards in the country and included our expectations that facilities actively encourage parents to participate in facility events as well as maintain open door policies. These requirements provided us with a strong foundation from which to build upon. When a facility signs up to participate, they begin at Level 2, which focuses specifically on readiness and reflection for facility leadership. Level 2 has two parts: self-assessment and core training, designed to prepare facilities for participation through self-reflection and assessing current policies and practices. Facilities complete two self-assessments, one on the environment rating scale and the second on the state-specific standards. 6 trainings are provided free of charge, and one of those trainings is a 6-hour introduction to strengthening families. The other trainings are the Introduction to Cultural Competence, Introduction to the Early Learning Guidelines, Introduction to the Core Competencies for Early Care and Education Professionals, Introduction to the ERS in Class, and a School Readiness Training, which lasts for 4 hours. The Strengthening Families introductory training, called Strengthening Families Training for Early Learning Professionals, Building Family Resiliency, was developed by our partners at Child Care Aware Washington. There are 4 primary goals of this training. The first is to provide an overview of the Strengthening Families protective factors. The second is to support early learning professionals' role in supporting families and promoting resiliency. The third is to provide an overview of resources and supports available to early learning professionals and family. And the fourth is recognizing risks and providing support. Training is delivered by state-approved trainers in local child care aware offices. All trainers complete a comprehensive train-the-trainer sequence on strengthening families before delivering the training. Following the Strengthening Families training, facilities can earn points for rating by completing the Strengthening Families self-assessment and subsequently developing a plan of action based on the results. Washington has also embedded an 8th strategy to the existing Strengthening Families self-assessment that was developed by our partners at the University of Washington, and it is targeted specifically to health. We call it Strategy 8, Enable, Empower, and Enhance Parent Skills in Health Decisions. It was designed to specifically promote strategies to support positive health and nutrition practices within the home and child care setting. In order to facilitate completion of the self-assessment, technical assistance specialists follow up with participants immediately after the Strengthening Families training to provide additional resources as needed. The plan of action is unique to each facility, and goals can be short or long-term depending on the resources and support needed. Participants are encouraged to partner with families to set facility-wide goals and can use the Quality Improvement Awards to help meet their objectives. Early Achievers coaches are trained in the Strengthening Families framework and can assist with developing a plan of action, including helping participants prioritize goals and allocating resources to support their efforts both long and short term. Washington currently has 10 coaches statewide, and we have plans to add more as the program expands. Currently, there are 37 approved trainers to deliver the training statewide, and our partners at Child Care Aware Washington will be holding another Train the Trainer event soon due to the demand and system expansion. The Strengthening Families training has been delivered by Washington State-approved trainers a total of 26 times in 6 regions since July, with a total of 184 facilities accessing the training. Participant response to the training has been overwhelmingly positive, with 84% of participants responding that the training will enhance their work with children and families and that they would recommend it to their colleagues. Another shift in our system is providing families whose facility is participating in Early Achievers the opportunity to provide feedback via our evaluation team at the University of Washington. Parents can volunteer to be interviewed by the evaluation team. It is not required, and it will not negatively impact the facility rating if no parents volunteer. However, it could benefit their rating as it will paint a more comprehensive picture of the facility's quality improvement efforts. And lastly, I was asked to share a couple lessons learned. And our first lesson, I think, would definitely be to start early and to define what family engagement means in the context of the broader system goals. I already touched on the importance of involving parents early and hearing what is important and meaningful to them. And once we took time to reach out to parents, we quickly realized that although parent communication and involvement is important, more active engagement is appreciated and needed. Another lesson was to assess the system's supports and resources that are needed on the ground. We discovered that the trainings and opportunities for professional development were needed in our state to effectively support participants, and made the decision to develop our own training in response to this need. Further, our technical assistance staff also needed training and support, and we had not necessarily considered that need at the outset. So it's important to look through the whole lens of the system rather than just pieces of it. And lastly, define the goals of your system and your goals around how providers and parents work together. Our goals initially were that families were welcome and active in their child's care, but we now prioritize partnerships in ways that are meaningful to each facility and the families they serve. We didn't want a cookie-cutter approach. We wanted each facility to define what they were working on, define what was important to them, define what was important to their families, not necessarily set the guidelines ourselves. And there's a value in reflection and defining individual goals and outcomes. And it's up to the facility to make those decisions and ultimately own them. So that concludes my portion of the presentation. So I will hand it off to Robin, and she can talk a little bit more about our work here in Washington.
Thank you, Char, and thank you, Anna and Debbie and Megan, for hosting us. So my name is Robin Higa, and I want to talk to you about a particular, to go into more detail about the project that Char talked about, and begin with my intention, and that has been, as a parent leader, to promote partnering with families in the development, implementation, monitoring, and evaluation of early childhood and family support programming. I believe that it is critical to best practice. It's the just thing to do because it is respectful of the fact that parents are the best informants of what they need to ensure the well-being of their child within their current social climate. As an ongoing practice, it allows systems that serve families to share decision-making power with those who are best informed. This results, I think, in more relevant, sustainable work that encourages cultural humility, including the development of QRIS standards. Parents developed the community cafe approach, which was used in this project in Washington after learning about the Strengthening Families initiative and the Strengthening Families Protective Factor Framework as a strategy to promote community and community relationships and partnerships with parents to strengthen families. It is also a leadership strategy. To learn more about the Community Cafe approach, we invite you to go to thecommunitycafe.com. Our website is a dual language website, and this approach has been developed and promoted by parent volunteers, and you'll find the site in English and Spanish, and the tools and resources on the site are also available in Vietnamese, Somali, and Russian. The project that I'm highlighting today and that Char spoke of resulted in a publication called Parents and Child Care Providers in Partnership, Planting Seeds for Success. It was designed and implemented by the National Alliance of Children's Trust and Prevention Funds in partnership with Washington's Department of Early Learning. Washington wanted to have parents, as Char said, inform their QRIS standards, so they partnered with the Alliance, who wanted to create a document detailing their process and the result, so it could serve as a model and a tool for other states. The resulting document is part of a series of resources that were developed as a result of the Alliance's partnerships with states. All of these resources are available at no cost, and to see this particular tool and document and the full array of other resources, please visit the Alliance website at ctfalliance.org. And you can also contact the Alliance at info@ctfalliance.org. The heart of this project, as Char alluded to, was a 2-day meeting inviting parents from around the state. And what is important about this project is that it relied on existing partnerships with parents from the community all the way to the national level. As a parent leader consultant to the Alliance and also a parent volunteer on Strengthening Families Washington, I was able to have conversations with Judy King from the Department of Early Learning, the project leader for this project at the time, and the Alliance to ensure the provision of supports which would remove typical barriers for stress-free parent participation, such as interpreters, transportation, lost wages, and childcare. Another parent leader, Terry Rowe, agreed to be on the agenda planning and facilitation team. A national facilitator, Charlie Bruner, that Char mentioned, and a local professional facilitator, Nalani Linder, and a graphic recorder, Claire Bronson, comprised the rest of the facilitation team for these 2 days. This meant that 2 parents and 2 professionals partnered together to design the 2-day meeting agenda. Having a parent as a facilitator helped to ensure a relevant agenda even as the meeting evolved and immediately put parents at ease when they arrived. The Department of Early Learning had a parent council, as Char mentioned, and a relationship with early intervention parent advocates, so they offered to invite parents who were already in leadership roles to attend the meeting. They asked me for assistance to find a parent facilitator, and the Department for Early Learning relied on the community cafe, on past community cafe work, which had developed a parent network across the state to invite parents whose voices were typically not heard and who came from marginalized communities and had children in early care settings. Because this project would be used as a tool for other states to possibly replicate, after the tool was drafted, the Alliance's National Parent Partnership Council members reviewed it and provided feedback before it went to final print. Coming to a state meeting with potentially national influence may have been an intimidating impersonal invitation had it not been for several parents who were already on the Strengthening Families Washington leadership team and who had a trusting relationship with Judy King, who also sits on this team. These parents could extend, more than Judy, a compelling invitation to this 2-day meeting and provide an orientation ahead of time in the language of the parent. The Community Cafe Collaborative also provided interpreters for parents who parents would feel comfortable with. During the 2 days, rather than interviewing, surveying, or utilizing other typical parent input strategies, at this 2-day meeting, parents were given a lot of time to have conversations with one another, guided by powerful questions. The World Cafe technology was used on the first day. The agenda utilized guiding questions for these conversations, such as, think of a time when you've had a positive interaction with your child care provider. What did you appreciate about it? Or, what are some ways in which high-quality child care settings help to develop relationships with you? And what are some ways a child care provider can help support your family or culture's ways of relating to each other? Parent partnerships were critical at every level of work, and parent perspectives were needed from the community to a national advocacy level for this project. This partnership mindset took more preparation time and conversation before the meeting, but it resulted in creating a setting where many diverse perspectives were able to be present and contribute their thinking. Nalani Linder likes to say, go slow to go fast later. Diverse perspectives involved in meaningful conversation leads to innovative thinking and fresh approaches to existing work. So what were the benefits and the payoffs? After the first day of several cafe conversations, parents, as Char mentioned, underscored that the most important quality in care is not only the relationship the provider has with the child, but also the relationship with his or her family, reinforcing the idea that partnering with families is critical to best practice. The second day of their meeting, parents delved into more detail of what this might look like and suggested indicators such as programs have a two-way communication with parents and family members that help to recognize and ensure program and home activities, customs, and behaviors are aligned or complementary. Another example is program staff provide opportunities for families to socialize and foster a sense of community, particularly by sharing and celebrating cultural customs and that are common and unique aspects within their community. I think a major aha was that a successful project that we got from this project was that a successful project builds on your existing strengths. One of the strengths we needed to rely on was our existing trusted relationships with parents and the community cafe work that already developed a powerful network across the state. You may want to draw your own relationship map to see where more relationships with parents could be developed to grow your work. Another aha was that at the state policy level, you may not have the time to have all the conversations needed to be more inclusive and may need to rely on natural community leaders or develop relationships with people who know leaders from marginalized communities or populations. This doesn't cost any money, just your purposeful intention. This project also reinforced that parents were the best informants on how to make a state and national project feel relevant to them and their communities, and in particular, parents who had not previously participated in a conversation having state or national implications. Finally, having a diverse planning team led to a richer, more authentic project that could elicit a more compelling invitation to parents and design a more relaxed, enjoyable day for parents. And it was an immediate affirmation to parents on the project's inclusive intention. Parents walked into the room and knew diversity was welcome because they saw it. People were able to relax, value everyone's presence, and be more open with their thinking and feelings. Another payoff was that some of the parents involved took their learning back home and shared it with others. This project not only strengthened existing relationships, but built new ones that could be called upon later. Next slide, please. This next slide is intended to honor Rigoberto Ortiz's contribution to this project and highlight how his wisdom has informed our work. In the picture, Rigoberto is standing off to the right. He's a non-English speaking dad from a very poor agricultural community who attended this meeting. Rigoberto is looked up to in his community as a dedicated, hardworking, and loving father and husband. His family was living in a substandard trailer park, and he has supported his wife and 2 young children by working on a farm 6 days a week. Because it was important to him that the children of his community have access to the best possible early childhood experiences, he agreed to participate in this meeting despite never having done something like this before. This was because he had a trusting relationship with someone who was hosting community cafes in his neighborhood, who also knew someone on our community cafe leadership team and this person sat on the Strengthening Families Washington leadership team and knew Judy King. So you can see the importance of this relationship link. Rigoberto knew he would be the only Spanish-speaking person there. During the meeting, Rigoberto learned information from other parents about the benefits of licensed child care facilities. He shared that most child care settings in his community do not have any kind of structure. Rigoberto was newly inspired to go back to his community and share ways that high-quality early care experiences can build a strong foundation for their children. He inspired me and others to think of more ways that licensed centers could be information hubs to help educate informal child care providers or family, friend, and neighborhood care. After this meeting, he said he had wished he had more time and an orientation to this project before the meeting so he could have spoken to more parents from his community and brought their ideas with him. So although we went slow in the beginning to go faster later, Rigoberto reminded us that there's still yet another reason to slow down even more, to allow parents who are coming to do some deeper preparation themselves. The lessons we've gleaned that you see here are from his wisdom. Not long after the project was completed, Rigoberto, along with his brother and cousin, died instantly in an auto accident. After his death, Rigoberto's wife was amazed at the support she received around the state and outside of the state even, due to his community work and participation in this project. Someone even gave his family a year's supply of meat. The Alliance made sure his children each received a copy of the seed's publication. They won't understand it for a long time to come, but eventually they will be able to read a published document showcasing their father's willingness and courage to venture into uncharted waters for their benefit and for the benefit of other young children in his community. When you think about the importance of partnering with parents, I hope that Rigoberto's courage will also inspire you to take bold steps into new partnerships with parents. So now I'd like to turn this back over to Debbie, I think.
Thank you so much for those powerful stories and thoughts about on the ground how important it is for state administrators and people constructing these types of systems to really understand the power and the fruitfulness of truly deeply engaging parents in the work at all levels. The state level, the national level, and of course the programmatic level. That was just a wonderful testament to the approach. In terms of questions, reflections, and comments, Anna has been dialoguing in the chat box with people and with the group as answering questions and as they've been proposed. Her email address is on the last slide, and on our webpage you can see links to the full report and the work. And if you have questions or would like to touch base with the speakers, I'm sure that Anna or I could get you in touch with Robin or Shar. I'd like to thank the presenters and everyone who was on our call today in thinking through and very deeply thinking about how we construct one of the most important elements of the QRIS work and how we think about engaging parents and families in their child's early learning and with our programs. Again, go to the QRIS National Learning website to view the recording. At the end of this recording, a brief survey will pop up as you log out on ReadyTalk. And that's not from the company, that's from us, wanting truly your feedback so that we can improve the work that we're doing with states. If you have ideas about topics or other things that you're interested in hearing about, please reach out to me. And if you're specifically interested in further dialogue about strengthening families, please reach out directly to Anna Lovejoy. Again, thank everyone so much, and to our funders for making this possible. Goodbye.
Thank you. Please stand by.